Everyone, welcome to the very first episode of Therapy Thursdays on Instagram Live. I'm so excited to be having the show. Therapy Thursdays is where we bring the therapist to you. I am your host, Marcus Alexander Velasquez, and I'm very happy you're here with me. We do have a disclaimer for the show, and I'm going to read it for you real quick. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. So, now that the legal stuff is out of the way, today's topic, we are talking about therapy in general. We have forthcoming episodes. They're going to talk about specific therapy topics in detail. But today I just want to introduce the audience to the world of therapy for mainly two reasons. One, many people just don't even know what therapy is like. They don't know the benefits of it. They don't know how great of a blessing it can be to sit down with a professional licensed, trained therapist and how much growth that can bring to your life. But the second group of people is for those who know of therapy but have either a negative view of it or just a twisted view of it, and especially in media. Because if you look at a lot of movies, when they have a therapist on the screen, it's usually a joke. Sometimes the therapist isn't even paying attention. They're doodling pictures instead of actually listening to the person speaking, or the common phrase, well, how does that make you feel? Therapy is so much more than just how does that make you feel. So I have gone through about 5 or 6 years of therapy on and off. I've grown tremendously from it. I've healed from a lot of past issues, and my present and my future are so much better because of that. Therapy is an amazing tool that I want as many people to know about as possible, which is why we do this show for you guys, so you guys can know about the amazing benefits of therapy. And if you guys click the link in my bio once the show is over, the third option down, once you click the link, says Therapy Thursdays. There is an online spreadsheet with all the information available for all of our therapists. So Jasmine's information is there. If there's a particular therapist for one of our episodes that you connect with and want to reach out to, you can find their information on the link in my bio, their names, their practice, email, phone numbers, how much they charge, the types of insurance they accept, any specialties that they may focus on. All that information is available in the link in my bio. Please check that out once the show's over. And as always, please share this video with your friends and family. The bottom right button is the DM button. You can forward this video to your entire friends list. We would love them to join, but we're going to get into it. So today's topic is therapy in general. Our guest therapist for the day today is the wonderful Jasmine Weaver. I am so glad she is here. She is the first therapist on this show. So like I said earlier, when this show blows up, she will have the honor to say that she was the very first guest on the show. So Jasmine, welcome to the show. We're very happy to have you here. Thank you for coming.
Well, thanks for having me. I really appreciate it. I'm excited to be here.
Yeah, absolutely. So can you give us a short introduction of who you are, a little bit about your background, maybe how long you've been practicing, if you specialize in any areas, and I'm personally interested to know what drove you to want to become a therapist in the first place.
Absolutely. Again, my name is Jasmine. I am a licensed clinical professional counselor. I've been licensed since about 2014, and I've been practicing therapy since about 2010. And I started in the field, just in like the social work field. I used to be a case manager in child welfare, so I did a lot of work with like DCFS clients, a lot of work with children and families. It's just something that something really does to my heart, is just like the family dynamic. I just think that's such important. If you have a supportive family, I think it could take you really far. Families not so great, sometimes that can kind of limit us in life. And but what I learned about working in there, if you have the appropriate supports in place and if you have connections with other people, right, they can kind of shore that up, right? Some of the deficiencies within the family. So that's where I got started. And then, like I said, when I started doing therapy in about 2010, it was also working with children and families that were involved in DCFS. I did a lot of work with like families after adoption. So
Mm.
they started in foster care and then they eventually adopted their foster children. And then I would like put in different supports there with the family to just kind of strengthen their bond. I've been in private practice now for about 5 years. I decided to venture out on my own. So I've been doing that part-time, and then recently I just went in and took a risk and jumped in full-time. So
Nice.
I'm actually,
Congratulations.
thank you. So I'm actually just kind of building up my clientele right now, and I'm just really excited about it. I really love what I do. I'm very, very passionate about it. And, I got started. I just feel like it was always a calling in my life. I actually started in college with law. Wanted to be an attorney, wanted to be a lawyer. And as I progressed in school, they were like, I was getting feedback like, oh, you shouldn't go into pre-law. You should do something that's more research-based. And so I ended up switching my minor and my major around, and I started majoring in psychology, and I just loved it. And so I stuck with it. But I had a very tumultuous upbringing in my life, and experienced some trauma of my own. And so I think I started studying it to learn more about me and some of the situations and experiences I went through. And then, yeah, here we are now. Long story short. So,
Awesome.
in my private practice, I specialize in trauma. I really enjoy helping individuals that are survivors of trauma. So that's like my primary focus, but I do a lot of work with individuals that experience depression and anxiety and, work stress and interpersonal difficulties and just a lot of different post-traumatic stress disorder, a bunch of different, areas, but those are my specialties, like the trauma field.
That's great. Well, congratulations on taking the leap of faith and going full time. I know that's not always easy, so I'm glad you believe in yourself enough to take that chance. So we hope the best for you. As for our
Thank you.
audience too, of course, one of the purposes of this show is not only to inform, but also to connect you with real life therapists. Jasmine is open, right? You are taking in new clients, correct?
Yes, I am taking new clients right now.
Awesome. So if you guys, after we talk here, if you guys find that you connect with Jasmine and would like to see her for formal therapy, again, please click the link in my bio. You'll see the third option on there says Therapy Thursdays, and it'll have all her contact information on there. You actually got a shout out right now in the comments. Someone said congrats. Yeah. So you mentioned something that this is the first question I actually want to ask, because you mentioned the word trauma, and unfortunately, certain words kind of get abused and overused, and because of all that, watered down. So some people can say, I dropped my sandwich on the floor and it was traumatizing. You know what I mean? So like in your definition and based on your experience, what actually qualifies as a trauma?
Okay, so trauma is basically like any experience or life event that actually threatens your life, right?
Mm,
And there can be two different levels of that. And this is just kind of how I think of it. There's like those physical traumas where like your physical body may be in danger, car accident, maybe you got held at gunpoint, maybe you almost drowned. Those are more like physical bodies, like threats to our physical person. But then there's like emotional or psychological traumas. And that may be like you were a victim of physical abuse or you're a victim of domestic violence. Those can be seen as more emotional and psychological traumas, but our life is still in threat, right? Our emotional well-being is at risk. And so those are how I like to look at it. But then there's sometimes like smaller traumas that we experience. So it may be like, a comment from a teacher when we were really young, like, maybe they criticized us or called us stupid, or,
mm.
just some criticism from one of our parents that can be seen as a trauma. It may be really small, and we may call it, sometimes people call them bigger case T's and lowercase T's.
Okay.
And so that lowercase T still has a kind of a threat on our personhood. And we can hang on to those things for many, many years. And then we start seeing them show up in our relationships. So how we interact with others, maybe how we show up at work, or even how we treat ourselves, you know, maybe a reflection of the trauma that we experienced early on in life.
For sure. Thank you for that definition. So since today we're talking about therapy in general, one thing I want to talk about is misconceptions of therapy. For myself, I really didn't have any experience in therapy. I didn't have any family members before me that had gone through therapy. So I really didn't know what to expect. I just knew I was hurting and I need some kind of healing. And you know, it was an amazing experience throughout that, of course, but it was firsthand experience. I had nothing to prepare me. So can you explain some of the misconceptions you've had with some of your clients where they thought therapy was supposed to be one thing and ended up, you know, realizing that it was something else?
Yes, there's tons of misconceptions. I think one of the biggest ones is just that, you know, people feel like they're crazy if they go and get help, or participate in therapy. And you don't have to have you don't have to have a diagnosis. You don't have to have some critical situation going on in your life to get therapy. What therapy really is a really just great self-reflection, self-growth tool. Like if you're looking to just be the best version of yourself as possible, I think therapy is just a good way to do that. I think one of the other misconceptions is that, you know, somehow the therapist, and I think we're moving away from this a little bit, but it's still there. Like somehow we're going to go inside your brain and like manipulate you in some type of way. And that's not what we're doing, right? I mean, therapists, we really study about, you know, human behavior, right? And patterns and things that we see, how people, again, show up in the world, and their different coping skills and things like that. But we're not there to come in and like try to manipulate you or like really change the essence of who you are. So that's one thing. And then I think that a lot of people have a misconception of therapy as being like just a vice. And that's really not what we do. And maybe some advice there. You may get therapists that do a little bit more of that, but you know, in our official training, we're really are taught to like steer clear of advice giving. We really don't want to advise you. What we want to do is give you objective like feedback. We'll get you to see things from a different perspective, and then we want to support you and make a decisions that you feel like is best for yourself or for your life. So a lot of people will say, well, I could talk to my friend, or, you know, I'll talk to my mom. But the difference is when you come to a therapist, I'm really objective. I don't have a personal stake in your life whatsoever, right? Whereas a friend wants you to do well, or maybe wants you to behave in a certain way because they directly benefit or they have a direct impact on what you do and how you change. And so as a parent too, like if you're in a relationship with a parent. So that's the difference. It's not just friendly conversation. We do actually utilize, you know, research-based techniques and different, you know, resources and things like that in therapy to kind of help you along your path. So I would say those are probably like the three things.
Okay, that was great. Yeah. Therapy as I think you hit some great points. I do think it is a misconception that people think by going to therapy you're crazy or something's wrong with you. I firmly believe that every person walking the face of this earth should have a therapist, and I believe every therapist should have a therapist. So, like, there's nothing. At the end of the day, we all have strengths and weaknesses. So that's where we start off. So if you want to talk about, oh, we're crazy or we're broken, you know, before having to go to therapy, like we all have strengths and weaknesses. We all have things that we can work on. So like you said, therapy is to help you become the best version of yourself. But that's a good point, because when you come to therapy, you have to have the mindset of growth. You have to be vulnerable. You have to be willing to be wrong. You have to be willing to have your current mindsets and the way you think about things to be challenged and possibly change. And that's not easy for everyone. Some people like being where they're at. And when you disrupt their status quo, you know, they could run away or they freak out. But therapy, as far as my experience, therapy is constantly disrupting your status quo because, you know, clearly whatever you've been doing at that point to get you to therapy hasn't been working. So you have to be open to new things. And what I love too, as well, is like, you're right. It's not just because there's a lot of people that will say, oh, you know, I sit down with my friends and talk with my friends. That's my therapy. I've heard people even say, oh, well, I go to the gym. That's my therapy. That's, with all due respect, that's not therapy. It may be a healthy outlet to rid yourself and get something off your chest, but therapy actually helps you heal. And that's the difference. If you're constantly running to friends for advice, but then come back the same, if you're constantly going to the gym and then coming back the same as far as like internally and with the issues going on, then it's not healing you. So real therapy is digging deep, and every session you should become gradually a better and better person. Now, to be honest, in therapy and depending where you're at in your life, I think it's a good thing to note that therapy isn't an overnight process. I want to explain again that I've been in therapy on and off for about 5-6 years now. And it took a while before I really started seeing like real, genuine change, but I had to dig deep. I had to realize that this was it's a journey, not a sprint. And it's going to take time. But I want to make that I want to distinguish that therapists aren't just a friend that talks to you. These are trained people that know what they're talking about. Like Jasmine said, they study human behavior, and they have tools that the average person doesn't have on their own. So like for myself, and we're actually going to do an episode on this. Jasmine, I don't know, are you familiar with EMDR?
Yes.
So I've never heard of EMDR in my life. For those who don't know what EMDR is, it stands for eye movement desensitization and reprocessing. That's why we're devoting an entire episode to it, because it's a whole thing to get into. But I've never heard of that before. But when I went to a professional was able to offer solutions that I wasn't able to get by going to the gym, by just talking to friends. So, you know, therapy has tools that aren't readily available to just the average citizen on their own. So another reason why therapy is so great and why I benefit from it, because there are ways and tactics that I didn't even know were available. If and when you guys in the audience maybe start going to therapy, there may be things in there you didn't even know were available. So sometimes you don't know what you don't know. And, you know, and sometimes you have to take the experience and opinion of someone you trust to try something. Same way you'll go to a new movie because your friend said, oh, this movie was amazing, so you're going to trust their opinion to go, or try out a new restaurant because your friend said it was delicious and you want to go. So from somebody, that's why I like being the host of this show, because I'm not a licensed therapist at all, but I've been on the receiving end of 5 to 6 years of therapy, and it's been fantastic. It has been one of the greatest things in my life that has helped me grow so much as a person, as a husband, as a friend. And that's why I'm doing the show, to help other people. For those who don't know, have never experienced therapy, to let them know, like, not only have I gone through it and survived, I've thrived from it. And it's an amazing thing that I still promote to this day. So yeah, therapy is awesome. Can we talk about, Jasmine, can we talk about some of the benefits that your clientele have seen? You don't have to really get like to specifics as far as like people's names and stuff like that, but like, have you seen, can you mention certain like either situations, maybe some phobias or particular traumas that you've helped people overcome and grow from?
Yeah, I actually have a client right now that I am getting ready to terminate and discharge from therapy, and
Nice.
she's been working with me for about 3 to 4 years. Came in because of severe anxiety, so frequent anxiety attacks and panic attacks, and just a lot of stress around that. I think, you know, in terms of just like panic, when we're having anxiety and they graduate to kind of panic attacks, we start having anxiety because we fear that we're going to have another panic attack. So just
Mm.
very important. And I was working with her a few days ago, and I was talking to her about it was time to terminate her. And I was like, I'm the type of therapist that when I feel like you're ready and you've made progress towards your goals, because that's the other thing. I work with you to figure out what the goals are that you want to work towards, and I utilize that to see the progress that you're making. So we actually develop what we call treatment plans, and so we have something to refer back to, so things are structured in therapy as well.
Nice.
But I don't recall. We were talking about this, just kind of going over her goals and her symptoms. And I mean, she has seen such a significant drop in her anxiety symptoms. Now,
Wow.
her anxiety hasn't gone away completely, right? Because nobody anxiety will ever go away completely. We actually need our anxiety to actually keep us safe in the world, right? Our anxiety is like an alert alarm system that says you may be in danger or something's amiss or something's off. But what ends up happening when we're suffering from anxiety, that system kind of overly responds,
Mm.
right? So we really worked in her like developing better coping skills to manage her anxiety. And now she's at the point where, she's still having anxiety, but it's not overtaking her life. And she has the tools and she's equipped to actually manage it so that now it's not getting out of control where she's having panic attacks and is ending up in the hospital. The other area she's improving upon is just her personal relationships. So it's really important that we have support in our lives, and we may not always get that from our family members, or
Mm.
even sometimes our friends are not always the supportive, or as supportive as they could be. But just working with her and really developing her support system and really finding a niche, just her tribe, I should say, because she had a lot of social anxiety as well. And so she's made a great new like friendship network. She just completed her degree. She's going on to get another degree. She's started a business. Like she's
Nice.
like really doing well, all because she, had the courage. And I talk a lot about that. It's just, when you come to therapy, it's not that you're weak or, again, that something's wrong with you, but you really have to have that courage to come in and open up and share things that are really vulnerable, things that you probably never shared with anybody, so you can make those changes. And sometimes you feel worse before you get better.
True.
But just like you go to the gym for the first time and don't feel that great, but the more that you go, the more that you practice at something, the easier it gets, the better you get at it. So that's like a success story. Now it took her some time, but she's doing really, really well.
That's great. Awesome. Congratulations for her.
Yes.
One thing I'd like to hit on is, as a BIPOC, as a person of color, I think there's a lot of stigmas around therapy and mental health. I know one of them is that, mental health or therapy has been predominantly known as a thing for white people,
Mm-hmm.
which is not the case. It's for all people. We're all people. We all struggle. We all need encouragement and growth. So therapy is for everyone. But I'd like to know your take on, like, a lot of our people that are watching are people of color. So if you could address them and kind of talk about, the need for therapy amongst people of color, the benefits of it, maybe some of the misconceptions about it. I mean, I've heard things by different groups of people. Some people will say, I don't go to therapy, I go to church. So if you can talk about the benefits of therapy for people of color, for sure.
Yeah, I mean, there's tons of benefits for people of color. I don't think they're any more or less different than the ones for people, white people or Caucasian people. I think they're just about the same. But I think for people of color, we have different experiences in this country. And so there's sometimes like our own because I specialize in trauma. So there's like our own trauma experiences from our own upbringing. But then there's like our generational or our ancestral trauma, right? Some of the battles that our ancestors fought to get to
Mm,
where we're at today. And that still impacts us. So even just a lot of the violence that we see in some of the communities of color, it's just a direct reflection of the trauma experiences that we've had. And so I again think therapy is for everybody. I think especially for people of color to have a safe space to really discuss and explore their experiences of being a person of color in this world. I think that's important because sometimes that um it's just that extra layer of stuff. Like if I'm already maybe suffering from depression or anxiety, and then I go into the workplace and I experience like racial microaggressions, like
mm,
that adds to how I'm coping or the symptoms that I am experiencing. So it's just another layer that you may need to break down and explore. Now, I think that it's important that you have a therapist that looks like you, okay?
agreed.
Because there's a certain level of them getting it, right? And them understanding.
Yeah.
And there's certain things you don't have to explain, certain nuances you don't have to explain because the way you show up in the world.
Mm,
However, that doesn't mean that when a therapist looks just like you, that they're going to completely understand or be trained in what you need help with, right?
yeah.
Or sometimes color therapists of color are so booked up you can't get an appointment in, right? Or they're hard to find, or maybe they're not a lot in your community, which has been a
Mm,
great thing about like telehealth. So I'm not opposed to someone of color actually going to see a therapist that doesn't look like them, right? But you want to make sure that they're aware, right, of how they're privileged or they've been trained in multicultural theories and just kind of have some type of understanding of what a person of color may be experiencing. And so if you are new to therapy and you're having a hard time finding a therapist that looks like you, I would say give it a shot with someone else because I know there's good therapists that are Caucasian that work with all different types of people of color. Same thing with sexuality and gender.
mm,
Because that is also coming up. So if you are a person that, and I always get this wrong, so I apologize, but the LGBTQ plus community, you may want to get a therapist that is also within that community. But keep in mind, if there are some limitations there, you may be open to someone else that has some specific training in that or feels comfortable working with that population. So there are a lot of ways to get around that, but do not let that stop you. You may start with one therapist and you may, get what you need from that therapist. And later down the line, you see someone else. Maybe, they give you a start and then you finish with someone else. But I would just say, I do think it's important to find somebody that looks like you, but don't let that be a barrier if you can't find someone.
awesome. Well said. You brought up a great point, and definitely one I wanted to mention is when you're stepping into the therapy world, especially if you know nothing or very little about it, if you haven't had a friend or family member gone through it before you to be able to walk you through the process, it can feel like a brand new experience, which it was for me. So let me share with you guys watching that your very first therapist you see may not be your last therapist you see. There may be a process of having to test out different therapists to find one that you vibe with, to find one that fits you, that you click with. Just like just like friends. The friends you had in grade school, you may not necessarily have today because at that time you needed certain things and now you need something different. So there's nothing wrong with that. I want to make sure you're prepared for that for those who do decide to move forward with therapy, that it is a possibility that the first therapist can get you so far and you may need to move on to someone else. That's what happened with me. My first therapist was not my last therapist. It was a great, excellent introduction to therapy. I saw the benefits of it. I got hooked. I was like, cool, this is what I want. This is going to help me grow in the areas I want to grow. You know, and I decided to move on to another therapist that I thought better fit me. And then that guy has been phenomenal for me. Like, I've been with him the most time. So just want to put that out there. Just because you see a therapist doesn't mean, bam, it's going to be the perfect guy right at the beginning, or the perfect woman, and they're going to give me exactly what I need. You may need to bounce around to a few therapists before you really find the one that works for you. But please don't let that discourage you. Your healing and your growth is available, but fight for it. You know what I mean? Not every single therapist may be the one for you, but trial and error. Just know
Yeah.
that there is one out there for you. Did you want to say something?
Yeah, I just wanted to say, because sometimes people actually have bad first experiences,
Mm,
and that is the thing. Like, you may go to 1 or 2 sessions and you really didn't have a good experience. And I just want people not, again, to be discouraged by that. You just have to try again. Like, I always think about doctors. Like, if you go in and your primary care doctor, you're not really gelling or feeling with them, you don't just say, oh, I'm just never mind having a primary care doctor. No, you pull out that directory and you find someone else and you give them a shot. And so it's the same way with therapy, but I know that people are usually in a very vulnerable state when they do get therapy.
yeah,
And so, just don't be discouraged. Just try somebody out, try somebody else out. And I think, like, just getting recommendations from family and friends, if you know somebody in therapy, that is really a great tool, because that therapist might not be for you, but maybe they can point you in the right direction. So you're not just blindly kind of selecting someone off like your insurance panel. So there's different ways to, find a therapist that may be a better fit for you.
for sure. So this is the part of the show, the second half of the show, we open up to live questions from the audience. We have 6 individuals here with us. We're happy that you guys are here with us. If you have any questions about therapy in general, maybe something you thought therapy was and now maybe you think it's different, maybe you have a misconception, maybe you had a bad experience like Jasmine said, or you just may have any other question that's therapy related, please type it in the chat. We would love to answer the questions for you to the best of our abilities. That's the whole point of the show, is to share therapy and therapeutic and mental health information, so you guys are better equipped for that. So again, if you have any questions about anything therapy or mental health related, please type it in the comments now and we will answer them as they come up. While people are putting in their questions, the next thing I wanted to ask you about, can you describe, again, because of misconceptions or just ignorance and not knowing what the process is like. Jasmine, can you please describe physically what the therapy process looks like? So obviously we have telehealth nowadays. So if you can explain what a telehealth experience would look like, and if you can explain what a face-to-face in-person experience looks like.
Okay. So usually, typically, and this is not with every therapist, but most therapists will start with like a 15-minute phone consultation. So you'll call, they'll get some information from you. You might discuss forms of payment or insurance, but then they're going to ask, like, what is it that you're looking for? What do you want to get out? Why are you calling today? And they're kind of like process and go through that and what your needs are and seeing if they're a good fit or not. And so that's usually where you start. Then they'll set up an appointment with you. Now, when I was meeting in person, that first session, we'll go over forms, informed consent. We'll talk about confidentiality, how I keep your records safe, and then I'll just educate you on the process of therapy. Now, because I'm doing telehealth, we kind of do that. That's more of a private thing. I'll send them their forms, they review it, and then I do a short review at the beginning of our telehealth session to make sure that you understand it, if you had any questions about that. Now, every therapist do their initial sessions different. Some people's sessions are more structured. They may have you fill out some forms or assessments, and some is a little bit more free flowing. I'm more of a more free flowing kind of person. I just kind of let you start the session where you see fit. Sometimes people have a hard time coming up with that. So I will just piggyback off of what we talked about in your phone consultation to get started. But usually I'm assessing how you're currently functioning and then what areas are you having trouble at. And then I may give you, I'm a cognitive behavioral therapist. And what that means is just, I think your thoughts translate to how you behave. And so in cognitive behavioral, we give a lot of homework out. So I may give you a homework assignment at the end of your first session, or I may just ask for you to be more mindful of something or pay attention to how you're feeling after the session, because a lot can come up in that initial session. And then we'll talk about goals to close out. So what is it that you want to get out of this? What do you want to work towards in therapy?
That's great. Yeah, I think that's a great point to make too, is the intake portion of therapy. Your therapist needs to get to know you, and your therapist will often ask questions about your past as well, because they need to get a well-rounded picture of who you are so that they can help you currently and helping you move forward. So in order for the therapist to help you the best that they can, it's not just, cool, what are your problems? Let's just go at it. They need to find the context of you. They need to find out who you are as a person. So they may ask a lot of questions about you personally. They may want to get to know your past, any traumas, anything that brings you to this particular session that day, or anything that happened that may happen in your family. So if you struggle with anxiety, okay, well, does anxiety run in your family? Is this a common thing? Like, so just so you guys know, the beginning process of therapy will be a lot of intake before you start really digging deep into the issue. So I just want to preface you guys that, so again, if and when you go to therapy, you are familiar with the process. So we got a couple of questions. Let me look them up. First one is from Cece. She says, how do you approach someone with several traumas? How does that person start therapy? I think that's a great question. Go ahead, Jasmine.
That is a great question. Yeah, I would say doing some research. There's a lot of different platforms. I guess one of the most popular, and I'm not advertising them or anything, it's like Psychology Today. A lot of therapists are on there, and they give a nice little bio, and they may state what specialties they work in. I'm a firm believer in finding a therapist that specializes in what it is that you're looking for. Now, there are certain things that most therapists have experience with, like depression, anxiety, those types of things, because they're usually they usually show up in whenever you're dealing with certain things. I don't know if that makes sense, but like that's always kind of an underlying issue, right? Depression and anxiety is one of the most common mental health disorders in our country. So they're always kind of lurking somewhere. But in terms of trauma, you want to look for someone that specializes in the type of trauma that you've experienced. And that can be like, they can be more general, like they're just specialized in trauma in general. And then there's other ones that may specialize in the specific trauma you have experienced. So let's say you're a survivor of domestic violence. You may want to see a therapist that has certification in domestic violence counseling. And that's because they have a specialized training to understand what victims or survivors, I should say, of domestic violence actually go through. And so you may want to start there. You brought up EMDR earlier. That's a trauma specialized type of therapy modality. And it's very unique. And I won't get into like explaining it, but if you're someone that have suffered from multiple traumas, that may be a good place for you to start. And you can just Google that, right? You can put in a zip code in your area and say EMDR therapist and see what comes up. You want to go to the website and see what the therapist is saying on their website, and see if that's someone that that you will gel with. I've had people even look for like specialized. I think somebody called me the other day and was like, my son's looking for a therapist and he wants someone that looks young. And I was like,
wow.
Okay, he's 18. Everybody's older than
him, right?
That's something he wants to be able. I said he probably meant cool, right? So you just want to see, okay, do you have this specialization, and does it look like I may gel with you? We may get along. I would say start there, and again, if you know anybody that's in therapy, that is also a great way to find a therapist. That person, therapist may not specialize, but therapists usually have a great network of therapists that they have relationships with. And so we will refer, like, oh, okay, I will do this, but I know a therapist that does have this specialization. I can refer you out to that person. So those are some ways to get connected. The other thing is going through your EAP if you are employed and they have an employee assistance program. That's also a great way to find, get referred to a therapist, and you get free sessions. And so that's always great.
That's great. Yeah, you brought up a great resource, which is Psychology Today. If no one's familiar with that website, please go check it out. It's psychologytoday.com. That's actually how I found most of the guest therapists. Is that how I found you? Did I email you off of Psychology Today? Yeah, see? So it works. Look, the proof is in the pudding. But basically, Psychology Today is a database of therapists. And you can search for therapists. You can get very granular with your search. You can search for location. You can search for specialties. You can search for price range, I believe. You can search for, you can search by insurance type as well to make sure that they take your insurance. So that's a great resource. So psychologytoday.com. If you haven't checked out that website, please check that out. That will definitely help you find some great, great credible resources. So Cece, I hope that answered your question. If it didn't, please feel free to write another one or let us know a little bit more. Our next question comes from Jasenia. She says, do you think that being in a low-income family home impacts how people feel about getting therapy? Would you also say that being a part of this low-income family group makes getting therapy harder?
Yeah, absolutely. I do think it makes it more difficult, right? Access. If you come from a low income family, you may not have insurance, right? Or you may have government issued insurance. And there could be some barriers and roadblocks to that, utilizing like a Medicaid or something like that, because the like community-based organizations is usually what takes Medicaid, and they're usually very filled. So you're probably on like waiting lists for a long time. And there are certain therapists that don't take Medicaid. And so there may be someone that specializes in what you need, but they don't take Medicaid. And that's if you actually have insurance, right? Because then there's a whole nother roadblock if you don't have insurance. And therapy can be expensive.
Mm.
And I mean, despite the expense, I do still think it's worth it. But you can always look to see if a therapist has what we call a sliding scale fee or sliding fee scale. And so basically that just means if you meet whatever criteria, and usually they differ from therapists and different providers, but they have a certain set of criteria that you can meet. So if like for instance, I do have a sliding fee scale. I base that off of like your income, or I may have certain fees that I do for students and different things like that. And so it's just kind of one-on-one kind of figuring that out. And sometimes they will have pro bono. Some therapists will just do some sessions for free. And that's something that we are really actually, not free sessions per se, but it's something that we're encouraged to do, is just to try to make therapy accessible for individuals. And so those are some routes that you can go. And I'm fully a believer in like kind of meeting my clients where they're at. So you may need to have a payment plan, and you can pay as you get income, and we can figure that out. Or sometimes you don't have it right now, or maybe you can only afford one session a month, and it'll take a little longer, but we'll just do what you can do, because I never want to put you in a situation where you're experiencing even more stress because you have that anxiety about whether or not you can pay. So and I forgot, it was the second part of that question.
I think she was saying, let me see. Oh, she just says, would you also say that being a part of this group makes getting therapy harder?
Yeah, I mean, I think I talked about
Yeah,
just sometimes there's wait lists. Sometimes the therapist, even if they do have, they take a certain caseload of like sliding fee scales, maybe they are booked up for that. So yeah, it does make it more difficult. But I would say like don't give up and don't be discouraged because there are people out here, there are different therapists and providers that will meet your needs.
for sure. Thank you for that, Jasenia. I hope that answers your question. If not, ask another question so we can provide some more clarity. Um, I know that there are resources out there, especially in Chicago, because we're from Chicago, that do offer either reduced fees or reduced services or even free services. I know there are organizations out there. I know of one in particular. They actually joined the live, but they didn't stay. But it's have you heard of coffee, hip hop, and mental health?
I have actually, and when I saw them pop up, I was like, "Oh, I need to email them because I tried to, I tried to get started with them to provide services. I really believe in what they're doing, and so yeah, there are some organizations out here that will actually front the cost of your therapy. So
For
research
sure.
them.
Yeah. So yeah, I know the gentleman who runs the organization. So yeah, for those who haven't heard of it, it's called Coffee, Hip Hop, and Mental Health. I believe their website is, what is it? Coffee Hip. So CHHAMH.org. But just search Coffee, Hip Hop, and Mental Health. Um, from what I understand about their program is that they connect people with therapists for free. They take their funding comes from their clothing, their coffee shop, and then they use a portion of those funds to help pay for people's therapy. So for sure, please look them up. I don't know all the details as far as how it gets set up, but I know the guy who runs it is an excellent guy. So I know that's a great program to reach out to. Are you familiar, just off the top of your head, do you know of any organizations or services that you can name for people that they can look up to get reduced or possibly free services?
Off the top of my head now, it's this one resource that I cannot remember at the moment, but I can email it to you and you can add it to like your resource list. But I know that they kind of do the same setup, like they will pay on your behalf for you to have therapy services. I just cannot remember the name of it right now.
All right. Hopefully it comes to you.
Yeah.
Sweet. If anyone else has any more questions, please ask. We would love to take advantage of Jasmine's experience and expertise. Um, yeah, is there anything else you'd like to add about therapy in general, and maybe something that will, if somebody's close, they're closer now to signing up for therapy because of this episode, but maybe they need like another nudge in the right direction. Is there anything you would want to say to them?
Yeah, just say, just take that leap. It could be a little scary, but I definitely believe like when you do things that cause you anxiety or some fear there, that's probably what you need to do the most is
Mm,
like kind of my ideology in life. Like if I'm thinking about it, but I'm scared about it, I probably should just do it.
yeah.
And so, and I mean, it's nothing to get a phone consultation, like just to kind of test the waters and see how that go. I think there's even some therapists that may just do all the like consultation via email, and
Mm,
so you don't even have to necessarily talk right away. You can try to just email them and see what's going on. But I would say, just take that leap. If you're thinking about it, go ahead and jump right in.
yeah, that's great. I know that unfortunately, not everyone's on the same path of healing and want to become the best version of themselves. So I know you have to be very careful. Same thing with like if you have big plans and big dreams, you can't tell them to everybody because
Mhm.
somebody will always be a negative Nancy and have something negative to say or put down your dream because they left their dream years ago. So I know that can happen as well with therapy because if you tell someone, a friend or a family member that, hey, I signed up for therapy, I'm going through this, if one, they have a negative view of therapy, two, they had a bad experience, or three, like I said, they just don't want to better themselves, they may discourage you while you're in your healing process and going through therapy. So do you have any advice for people who would be going to therapy, who they should share that information with? Maybe there's certain people they shouldn't say, tell them that they're in therapy. How would you address that?
I mean, I always encourage people to share with whoever they feel comfortable with, whoever they feel like they can trust. You can, share your experience with therapy. Because I think part of like lessening the stigma of therapy is actually just people that actually attend talking about their experiences with others. And that doesn't mean that you got to go in great detail and disclose everything you're talking about in therapy, but just sharing, like, oh, so and so go to therapy. Oh, wow. Like, because somebody may really look up to you and they may think you have it all together, and you're like, oh, well, I'm in therapy. And that may just give somebody else the confidence, like, oh, okay, well, now that makes me feel better. I'm going to go to
Right.
therapy. So I definitely believe in sharing your experience. But I would say, like, if there are people that's been highly critical of you, that may be individuals that you may not want to share that you're going to therapy with. If there's a person that, again, I do a lot of trauma work, if there's a person that you're still associated with that has been a perpetrator of that trauma, you may not want to share that with that person just for
Mm.
your own safety reasons. Especially, again, individuals that have like experienced domestic violence, they may not want to tell the perpetrator that they're going to therapy, because that may be actually a risk to them. So again, if a person hasn't historically been supportive of you or been critical of you or make you feel unsafe or uncomfortable, I wouldn't share, with them. But this is what I will say. Anytime that you're in therapy, your relationships are going to change. They may
Mm.
change for the better and they may change for the worse. But
Mm.
just the fact that you are in therapy, your relationships are going to change.
Very good point. I'm very glad you said that because that is very true. Um, yeah, the more you grow as a person, your standards grow with that, your boundaries grow with that, and if the people you surround yourself with aren't on this growth process as well, then you're very right. Some people may get left behind. Some people may even exit themselves and not even like the path that you're on. You're like, forget this, I don't want this. So, find those that share common interests. Someone like me, someone like Jasmine, people who fully support therapy, who just want to be the best versions of ourselves, who want to grow, know we have areas that we can grow on and get better at. Surround yourself with those types of people, because yeah, I mean, even a discouraging comment from a friend or family member could turn someone off from therapy and be like, oh well, I'm not even going to bother because so and so said this, and I'm discouraged now. I don't even want to go. So yeah, that was a really good point. I want to talk about something you hit up earlier. By the way, again, if anyone has any more questions, we will be rounding up the show fairly soon. We got about 8 minutes left, so now is the time to get your questions in. So please type them up. But I do want to hit on a little bit on the topic you mentioned earlier, which was that things can get worse before they get better. And if you could please expound on that, because that's very true. Because to get to a point of healing or growth, there are times where we do have to go back and we will have to revisit traumatic events. We will have to re-experience that pain, physical, emotional, whatever it may be. So if you can talk about that too, to help people prepare for therapy again, to know what they're getting themselves into, because if the first session they're like talking about old memories and it scares the crap out of them, then they may not never come back. So if we can prepare people as best as possible, that would be great. So yeah, if you could talk a little bit about things getting quote unquote worse before they get better.
Yeah, I mean, you come to therapy, there may be some really heavy stuff that you have to process and get through. And most times, the way, and not every time, it kind of depends on each individual circumstances. But a lot of times, when we'll come in that first initial session, or the first few sessions, what we're going to try to do is see what's going on and how this, like, your issue is showing up in your life. So, like, for me, I do a check to see, like, are you sleeping? Are you eating? And are you getting some type of physical exercise? Those are, like,
Mm.
the main things I start focusing on, is the basics, right? Because a lot of times we're not sleeping, we're eating junk food, or we're not eating at all, or, we're laying on the couch after work because we don't have a lot of energy. And so I want to make sure you're getting the basics covered so you can actually deal with the stuff we're going to actually talk about later down the line, right? So I
Yeah.
want to help you get your coping together. So once we start peeling back all those layers, you have certain things in place already that you can deal with the emotions that come up after we kind of dig deep into, our past. So that's kind of where I would start. And sometimes it is tough. Like, you don't come into therapy on certain days. First of all, you're not gonna want to come. There's gonna be certain days you're
Yeah.
gonna be like, I don't even feel like doing this today. I don't want to do this today. You're gonna come in and you're gonna leave crying. You're gonna be like, oh, I feel terrible. I just want to go home and sleep. I want to eat some cookies and just lay down. You're gonna have those days. And other days you're gonna come into therapy, you're gonna be so excited. It's gonna be
Mm,
something that happened, and maybe not the best thing that actually happened to you, but the way that you responded in a different way, you're
mm.
gonna be so excited to tell your therapist, like, guess what? Let me tell you what happened to me today. And so you have those moments. And I say as you go further along, I would say those days where it's harder or you leave feeling worse, I'll say they are few and far in between, but they happen a lot earlier on in therapy. And when you were asking about that, I was thinking about in those situations, like when you have some type of injury or something, you have some medical condition, and they're like, "Oh, we have to break this bone so we
Yep.
can actually heal this part of
Yep.
you." They actually do that to heal you. Like, we're gonna break your bone, and by doing that, we're gonna set you up so you can better heal.
That's
And that's
good.
what that's how I think about it. Like, okay, you may get a little broken a little bit, but what we're doing is setting you up so you can be stronger in the future.
Absolutely. Well said. Yeah, that reminds me of my early therapy days, and it was the same thing. It was painful. It was revisiting traumatic events, but I was already in pain. That's what the pain was what brought me to therapy. So my mindset was, I'm going to go through pain regardless. So I might as well go through pain that's going to lead to eventual healing. So that was my
Hmm.
focus because keeping the stuff inside, I was experiencing all the pain. Nobody else knew about it, but it wasn't going anywhere. It was snowballing throughout the years. So at least in the therapy office with the therapist, it's like, okay, we're going to go through some painful stuff, but there's a promise at the end, but there's light at the end of the tunnel. Things will
Right.
get better. Therapy
Right.
has a great track record. There are people who have grown tremendously from therapy. Therapy has saved people's lives for those who are suicidal, or, you don't even necessarily have to go that far to end your life physically. Some people, they're alive, but they're not living. You know what I mean?
Yeah. Yeah.
So yeah, so it can get a little dark before it gets light, but just know
Yeah.
that at least that pain has a purpose to it, and there is healing behind that pain.
Yeah. And some of that too is like re-experiencing some of those events you've been through, and you'll have those same emotions, but you'll have a person that's sitting in front of you being objective, being empathetic, being supportive, and that helps kind of transform that event, because a lot of times when we have a traumatic event, we don't have the support around us to help us make sense of what's happening to us,
Mm,
or maybe they're not giving that emotional support that we need. And so when you come in and you re-experience these events from your past, and you have somebody that's supportive and just really seeing you for who you are, that can really just really aid in your healing.
yeah. Absolutely. Awesome. Jasmine, it was an absolute pleasure having you on the show. I can't wait to have you back. We have more spots open, so if you want to visit the spreadsheet and there's
I'm
anything
gonna
else you'd
check it
like to
out.
talk about, come on back. We'd love to have you. As always, I'm going to read our disclaimer again for those who didn't hear it the first time. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. So again, our wonderful guest today was Miss Jasmine Weaver. Thank you again for being here. I truly appreciate it. For everyone watching, please go to the link in my bio. The third option down, once you hit the link, will say Therapy Thursdays. Once you click that button, it will bring you to an online spreadsheet. That spreadsheet has all the contact information for all of our guest therapists. Number one on the list will be Miss Jasmine herself. You'll see her name, her practice, her email, phone number, all the information you need to contact her. If this episode of Therapy Thursdays has sparked something new in you and you are interested and would like to pursue therapy, please reach out to Jasmine. I know she's taking on new clients. I know she'd love to answer any questions you have through email or through a phone call. Please reach out to her. Therapy is an amazing tool, but the tool only works as well as you work it. So you actually have to go out there and get her done. So thank you again, Jasmine, for being on here. Thank you, everyone else, for tuning in. Do you have any final words you'd like to tell the people?
Yeah, I was just going to say, if, you do have questions, or, you want to discuss your needs a little bit more and see if I can help and point you in the right direction, please reach out. I would much rather prefer you reach out, even if I'm not the one that you're going to be working with. I'll try to connect you with someone who can. And I really just appreciate you inviting me on. I really enjoyed myself, and I'm definitely going to check out some more topics. And it was just lovely being here and talking to you guys.
Awesome. Well, Jasmine, have a great night. Thanks again for being here. Everyone else, have a great night. If you have any questions for Jasmine, you can find her info in the link in my bio. If you have any questions for me, you can DM me after this. But thank you guys for joining, and we'll see you next week at 7 o'clock.
Work, work, work. Watch you do my